If you deal with chronic gut issues, you already know how exhausting the daily physical frustration can be. It is a constant, localized pressure that sits heavy in your abdomen and disrupts your life. To fix it, we have to define exactly what is happening. This clinical algorithm shows us the first question doctors are trained to ask. Are you experiencing visible distension, a feeling of bloating, or physical discomfort? Two biological mechanics drive this discomfort: visceral hypersensitivity, where the nerve endings in your gut are overreactive, and dysmotility, sluggish, slow-moving intestinal muscles. Because the root cause is a mix of sensitive nerves and slow muscles, random internet diets rarely work. What you actually need is a targeted, step-by-step clinical action plan to systematically rule out triggers. The data supports this approach. As this clinical integration chart shows, roughly 70% of patients can resolve their symptoms using this specific algorithm without ever needing expensive medical workups. The algorithm begins with step 1, the safety screen. Before you try any diet, we must rule out serious structural issues. Mentally check for red flags: unintentional weight loss over 10%, any bleeding, persistent vomiting, or family history of severe gut diseases like IBD. If any of those red flags are present, pause this plan right now. You need to see a doctor immediately for structural tests, like an ultrasound or a complete blood count. Assuming you are clear of those alarms, step 2 requires evaluating for constipation. Take a moment to evaluate your daily habits. Are you dealing with hard stools, straining, or infrequent movements? Think of your digestive tract like a pipeline. Backed up stool acts as a physical dam. It traps the normal, everyday gas produced by your digestion, causing immediate and severe bloating upstream. The immediate fixes for this plumbing issue are straightforward: increase your dietary fiber, or use osmotic and stimulant laxatives to clear out the backlog. Fixing the plumbing is the absolute foundation of gut relief. Look at the clinical note marked with a green star here. For many people, simply unblocking the system cures the bloating entirely without requiring a single dietary change. If bloating remains, proceed to step 3, the 2-week targeted dietary restriction trial. First, eliminate lactose, which has a 51% prevalence, and fructose at 60%. Next, restrict sucrose and sugar alcohols. Avoid complex low FODMAP diets alone. A dietitian is marked as not optional. Stick to isolating our 4 specific triggers and keep your timeline strictly to 14 days. This is a short-term trial to find what bothers your gut, not a permanent lifestyle sentence. The goal here is simple. If your symptoms resolve by day 14, the trial has successfully acted as both your diagnosis and your cure. By systematically isolating these 4 specific triggers over a short, strict period, you find the exact source of the discomfort and avoid the exhausting trap of permanent food fear. What happens if the 14-day trial finishes? Your constipation is resolved, but physical symptoms persist. This is where we use the escalation protocol. The algorithm provides selective secondary tests, including breath testing for SIBO and screening for celiac disease. Notice the red stop hand. Unguided testing risks false positives and misdiagnosis. Test for SIBO only if you have risk factors, like prolonged antacid use or gastric bypass surgery. Advanced diagnostic testing is a highly specific tool meant for outliers. It is not the place to start. Let's recap your finalized action plan. 1. Screen yourself for medical alarms. 2. Clear out any hidden constipation. And 3. Execute a strict 14-day restriction of lactose, fructose, sucrose, and artificial sweeteners. Following this sequence addresses the daily triggers behind sluggish muscles and hypersensitivity to achieve a lasting clinical resolution. Your next step is immediate. Open a note-taking app right now. Write down those 4 dietary triggers to avoid, and officially stamp today as day 1. As the bottom of the clinical guidelines remind us, a targeted, stepwise evaluation always beats random guessing. It saves you months of time, avoids unnecessary medical bills, and gets you back to living comfortably.